I started practicing in Brampton in 1987. I do general pediatrics as well as nutrition and developmental and behavior pediatrics because I have special training in that area. So I see patients with autism, ADHD, behavior pediatrics, etc. On the whole, we serve a population of 1.2 million.
My brother was a community pediatrician, and so I would say that I was lucky to have gotten into a practice where I had somebody who was experienced, was encouraging, and to a certain extent a mentor to me. And I saw his community practice, but also did some scholarship research. So that's what really drove my passion for community pediatrics.
I was a general consulting pediatrician in Langley. I started in 1987. Throughout my career, I had a huge variety of patients, having about half my practice being respiratory, mostly asthma, of course, but other respiratory conditions as well. I was in charge of the pediatric pulmonary function testing at Langley Memorial Hospital. So that gave me another area of practice to do, and I did some group medical visits for asthma, working a half a day a week and I continued to work at the Child and Youth Mental Health Clinic a day a week.
I was raised in a family with a physician father, a surgeon, and I always thought that I would be a physician. Did a split residency, did a public health degree. I worked as a medical officer for a few years, but I really missed the clinical work with little kids and went into clinical practice where I did a consultation kind of practice. The opportunity to, alter policy and supports to family and parents was terrific.
When I started, I thought for a little while I was going to be an oncologist. And towards the end of my residency, my husband and I really started to talk about what it was we liked and where we wanted to live. And we realized that we really wanted to live outside of a big center. And I ended up in Aurelia because I was doing a rheumatology rotation with Dr. Ron Laxer, and he was asking me what I wanted to do, and I described to him what I thought I might want to do. And he said, well, you need to go to Aurelia because that's a great place for you to do what you're describing. And so I ended up here.
Now we've settled more into hiking. It initially began as an endeavor to run a marathon. We've done a few great hikes, my wife and I. We've done Kilimanjaro and the Machu Picchu Trail, which was quite an interesting hike, so really enjoyed that. Previously, I used to play squash, and I've got a black belt in karate, so that's...
I enjoy riding a bicycle. And my husband and I have a tandem bicycle, so I cycle on my own, and he and I tandem cycle. We've done a lot of touring. I'm not fast, so I call myself a touring cyclist.
I did a lot of traveling, I love traveling. I've been to most places, from China to South America to Machu Picchu to Galapagos to New Zealand to Australia, Vietnam, went to Laos as well, Thailand. So did a lot of traveling, you know what I'm saying, is I've been somewhat fortunate to be able to do that.
It would be golf. It's an addiction for some of us, so I love golfing. We've cycled together, we've traveled all over the world, so it's been a rich and full and fun life for the most part.
I love to be outdoors and be active. And I'm an avid kayaker, runner. I love to trail run. And then in the winter, we're all really avid cross-country skiers. My daughter was raced on the provincial team. So that's the kind of stuff I like to do.
Some of the challenges would be, first of all, we find that just supporting those families during that time and finding resources to enable supports for the families, right? That's been challenging. And a lot of pediatrics is now becoming multidisciplinary because it's become complex, and we need allied health professionals to be supporting us. So
trying to get the trust of the public to encourage them to do the health positive behavior, it's forever a challenge no matter what the issue is. It's different when you're working in a clinical practice, and they've come with a problem that you're solving with them or looking for a diagnosis or a treatment. That's different than trying to shape policies that can make us all healthier.
Community, the hardest part is getting resources for certain disorders, like mental health, for children with autism, even children with ADHD, getting counseling and all the necessary resources that you require to provide optimal care for these patients.
The times when you know what to do to help a kid, and there's barriers. And the barriers can come from a number of different places. It can come from the system where you know what should happen and you can't make it happen. That's really frustrating. And it's equally frustrating when you've got a vulnerable child, but you have a family who has challenges and can't carry through those recommendations. And that's really challenging. It's really hard to not be able to help. I think that's probably the most challenging piece. And that can happen, those barriers can happen for a whole number of reasons.
It's a privilege to practice pediatrics. I love my interactions with the children and families, whatever they're living through. They're so delightful, they're resilient. I'm always so impressed, and their dedication is so amazing.
I lived in a small enough community, and I was there for long enough, and watching some of those go through adolescence and enter early adulthood, feeling that I had helped them and made a difference for them and their families. But that was really rewarding. And
I love the variety of things I get to do. I love that I'm using everything I learned in residency, and particularly in a smaller community, I love how much of a voice we have as community pediatricians. So for example, when I started in Aurelia, we didn't have a neonatal follow-up clinic. And so within a year of being here, I had done all of that and established a neonatal follow-up clinic. I feel like we can be really good advocates for kids here. And that's pretty powerful.